I'm Sharif Ibrahim. I'm one of the medical oncologists at Baptist Medical Group. Me and my partners, we are privileged to help patients with cancer, with diagnosis of cancer, to get through their treatment. And not just through their treatment, but also with the follow-up and the surveillance and sharing their journey being survivors since the first second they hear about diagnosis of cancer. Survivors are all patients who got diagnosed with cancer or even pre-cancer condition at any point in their life. This could be stage 1, stage 2, stage 3, or stage 4 cancer. The number of survivors who are living out there around us, whether they are friends, family, or whether it's you, is just growing in number every day and every year. And this is just because of the impact and the importance of the treatment and the improvement in cancer treatment over the last few years and few decades. Proud of yourself that you are a cancer survivor. I also call the whole family and the support group as a survivor family, a survivor group of people that helped a loved one to get through this diagnosis, through the treatment, and the years to follow after treatment.
Hello, my name is Dr. Nicholas Drake. I'd like to talk to you today a little bit about some survivorship surveillance topics. So cancer survivors face potential psychosocial, practical, spiritual, informational challenges that can begin during active treatment and persist post-treatment, or even occur months or years after treatment has ended. The purpose of cancer survivorship surveillance is to monitor for disease recurrence and screening for second primary cancers. Now, every cancer patient is unique. Their cancers are unique as well, and your surveillance is tailored to treat you. With that in mind, make sure you keep your follow-up appointments with your cancer physician. Those are the most important. The most important way for us to detect if your cancer has returned or if you have a new cancer is by talking with us face-to-face and letting us examine you and go from there. You tell us what we need, we help you get through it.
My name is Sweta Jonalagada. I'm one of the medical oncologists at Baptist Hospital. When we talk about survivorship, the transition between active treatment to post-treatment care is very critical for the long-term health of our patients. Oftentimes, in the beginning, during the acute care, there's a lot of coordination of activities, well-versed experts that are involved in their cancer care, which often transitions to less frequent contact with the medical providers. But it's important to recognize that our patients still face a variety of medical and psychosocial challenges during this period that need to be carefully looked at, coordinated, and managed. Specifically, the medical problems that we often see post-treatment have a lot to do with the consequences of the actual cancer or the treatment that they're receiving. For example, common things that we hear from our patients are fatigue, pain, sexual dysfunction, appetite changes, weight changes, side effects of surgery such as lymphedema, and these are psychosocial challenges, not only for the patient itself, but also the caregivers. Oftentimes when our patients finish treatment, we hear time and time again that they worry that their future is uncertain. There's a lot of anxiety about the cancer coming back, and also that the patients may feel that they're not doing enough to detect the cancer recurrence. Some of the other challenges that we see immediately post-treatment is the transition back to the work life and how their medical challenges impact their employment. For our young survivors, especially females, some of the conversations that we have are regarding fertility and contraception planning. So all of these are critical components of medical challenges that we discuss post-treatment. And one of the key focus of survival is healthy lifestyle. And we know that research has found that adopting a healthy lifestyle does decrease the risk of recurrence. And many of our patients develop long-term side effects such as obesity, diabetes, high blood pressure, heart failure, bone loss, and some of these are the long-term consequences of cancer treatment. So some of the strategies of healthy lifestyle measures include dietary changes, incorporating regular physical exercise, mobility in terms of physical therapy, limiting alcohol intake, smoking cessation, stress management, especially with incorporation of our comprehensive care team, including our social worker who helps with stress management, and also support groups. So these are several ways of adopting healthy lifestyle to decrease cancer risk. Thank you.
My name is Syed Imran Jaffrey and I'm a hematologist oncologist at Baptist Hospital. Whenever I see a cancer patient, my first goal is to get them back to their life before they were diagnosed with cancer, to get them the same quality of life, to get them back to where they were before they were diagnosed with cancer. Cancer survivorship program plays a very important role in that. There is a part when you are initially diagnosed and then treated for a cancer. That includes surgery, radiation, chemotherapy, and that's a journey. Once you finish that journey, you move on to the second part where you are a survivor and you have defeated the cancer. Why is cancer survivorship surveillance important? Number one, cancer itself. If we catch the recurrence of the cancer early by doing regular scans, regular lab work, we can potentially cure the cancer. Number two, managing the side effects from the treatments such as long-term surgical complications, radiation complications, chemotherapy complications, so that you can enjoy good quality of life by us managing those symptoms. Number three, sometimes these treatments, radiation, chemotherapy, these treatments can have later long-term side effects which show up few years down the road. It's important for you to keep following up with your physicians for us to catch those things early and manage them. The other important part is what things you should be aware about when you are not seeing your oncologist and going on with your lives. You need to understand what type of cancer you had and what treatment you underwent. This is important for your other physicians or in case you require any emergency care, so that they can understand your previous history and manage you accordingly. Now, our goal when we start treating cancer is to get you back to your life before cancer, your same quality of life. Sometimes that's not possible. Sometimes it's not possible because of the side effects of treatments that you go through. Sometimes emotionally, it's never the same. But we are here to help. Understand your new normal. Understand if there is anything changing emotionally, physically. We are here to help and we can help manage all those symptoms.
Serving in the role as an oncology provider, we have a unique perspective as we walk with you from diagnosis through treatments, through surveillance. And for this reason, we are in awe of your strength and resilience. We're so proud of our survivors, and we want to remind you of not only how far you have come, but of the life that is still waiting ahead of you. We thank you for participating in our discussion about the importance of cancer survivorship surveillance as a part of our Survivorship Week celebration. If you're a survivor wanting to know more information on how to re-engage survivorship surveillance, or with general questions, please feel free to contact our Baptist Healthcare Oncology Office at 850-469-7975. Thank you.